Hello and welcome to Nature Source Care. My name is Dr. Funda Gulman. I'm a naturopathic physician, and today I was going to talk about how to do a nasal rinse, also known as a nasal irrigation or nasal lavage. This is a technique in hydrotherapy. Hydrotherapy is near and dear to my heart. I actually was a professor of hydrotherapy, teaching medical students different techniques in hydrotherapy. But this topic came to mind because over here on the East Coast, last week or so, there's been some really intense air quality issues because of fires going on in Canada. And so this is a technique that, things are getting better now, but this is a technique that's helpful in all kinds of situations, as we'll discuss, but including something like environmental toxins and pollutants, irritants, that sort of thing that may be in the air and irritating the nasal passages, sinus passages. So let's get into it. Please note the information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that persist or worsen, please consult with a qualified medical professional. It is always best to determine the root cause of any disease and to develop a comprehensive treatment plan. And while hydrotherapy can be very effective, it may not be appropriate for everyone or as a single therapy, so please keep that in mind. So what is hydrotherapy generally before we get into nasal rinsing? Hydrotherapy is the therapeutic use of water to treat disease. It's also known as water cure in kind of a history of naturopathic medicine. There's other words, terminology that are related to hydrotherapy but mean slightly different things. So there's balneotherapy, which is actually curing disease by bathing specifically. So nasal lavage would not qualify. There's hydropathy, which is the use of hot and cold to effect cure. Water can be a vehicle for this technique, but not always. You don't need water to, apply hot and cold. There's also thermotherapeutics, which is the modern term for hydropathy. There's thalassotherapy, which is curing disease with seawater specifically. And then there's water therapy, which is physical exercise or therapies in water, usually a pool. So again, if you're, a hydrotherapy nerd like me, these terms actually are pretty different. So just in case you come across them, if you happen to be reading literature from like the 1850s in hydrotherapy like I've done, then this will be important. But otherwise, for most of you, it probably all sounds the same. So let's get into nasal rinsing, though, again, also known as nasal irrigation or nasal lavage. So benefits and mechanism of action. Well, essentially what you're doing is you're cleaning out and rebalancing the nasal passage and the milieu therein. So your primary aim for most people is to improve breathing. And by doing this, what you're doing is clearing out toxins, irritants, and even infectious pathogens that are causing problems in the nasal passages and problems in the upper respiratory system. It can also improve or help to decrease allergic symptoms. And all the sort of, typical symptoms that come up with things that are like toxins, irritants, infections, allergies. So decreasing inflammation, decreasing itching. Sometimes there can even be bleeding if it's really extreme. Dryness of the nasal passages, but also too much wetness, so maybe too much mucus, and then pain that's associated with the swelling and inflammation. That can radiate and cause even like headaches and ear pain and stuff, and problems with the jaw if it's really extreme. The other thing is that actually nasal rinsing can be used to help improve clarity of mind. This is coming more from the sort of Ayurvedic or traditional Indian medicine perspective, or even the yoga perspective. Typically, nasal rinsing is done daily as part of a kind of a daily routine, daily hygiene routine, but also before yoga, meditation, pranayama, or breathing practices, so that there's clear flow of air and energy, chi, prana to the brain. So that may be of interest besides all this sort of more physical medicine stuff. There's the energetics along those lines. So basically what you're doing, the mechanism of action, is you're doing a physical flushing, you're rebalancing the milieu, and you're also delivering potentially other therapeutics besides water. Because water itself is, the universal solvent. It helps to rebalance dryness or too much wetness or too much, thick mucus, that sort of thing, just to get the environment back in balance. And it can deliver different therapeutics, which we'll talk about. So that's kind of why you might be interested in this. So more specifically, we touched on some of them just by the benefits of nasal rinsing is that, nasal and sinus infections can be helped with this by delivering therapeutics, allergies, physical irritants like work, like maybe you work in manufacturing, or some sort of environment where there's a lot of aerosolized irritants or products in the air, and also environmental. So as I mentioned in the beginning, like right now we're having difficulty with air quality because of forest fires that are going on in Canada. It's actually blown all the way down here to Connecticut. And so, just the other day, I think it was Wednesday, it was pretty tough. I was getting headaches and stuff like that. So, and that's the thing is, luckily for us, in some ways here, the air quality is usually pretty good, so it's just a temporary thing. But, I've also visited like Beijing, and when I went there, I woke up in the middle of the day, but I thought it was the middle of the night because the air was so thick you could barely see the sun. That was really confusing. And they actually have something there called a Beijing cough because there's so much pollution in the air there that you touch down and, I was coughing for the first week, and then luckily I was doing hydrotherapy and stuff like that to rebalance my system, and it cleared away. And I don't typically have, respiratory issues, so I was lucky that the hydrotherapy was enough in that case. But some people it was chronic, like my host actually, it had a chronic cough from the, pollution and air quality issues in Beijing. So. Other things that can be helped by nasal rinsing, so biological pathogens. So maybe you're somebody who works with patients or maybe children or something like that, and you're exposed to a lot of biological pathogens. This would be potentially something good to do at the end of the day, to make sure that you're not picking up pathogens from other people. Anosmia, so if there's difficulty with smell, this might potentially help to get things back in balance depending on what's causing the anosmia. As I mentioned with, the tradition of yoga, Ayurveda, lack of mental clarity and focus can be helped with nasal rinsing. It can be part of a daily hygiene practice and preventative for some of the things listed above. The thing, though, is that nasal rinsing may not be enough. You have to consider the whole, not just the milieu of the nose and the sinus passages and that sort of thing, but the milieu of the whole body. We talk about in naturopathic medicine that the whole body is more like a garden. And is this person constitutionally, and this gets into Ayurveda or traditional Indian medicine a bit, it's like, is the constitution of this person tending to be dry or vata, or is the constitution of this person tending to be, thick and wet, like somebody who has a kapha constitution. So, and not only that, but whatever they might be breathing in. So like, we've been dealing with COVID, still dealing with COVID. COVID, for example, is a vata pitta type of pathogen, meaning that it's windy. Vata means wind, and pitta means fire. So COVID causes inflammation or fire, and then because of so much fire, or in addition to the fire, it tends to dry things out. And COVID mostly affected people who were older, who tend to be more windy and fiery rather than children who tend to be more kapha or earthy. So you can also kind of know what your pathogen is, what the typical symptoms are, and what direction they go to help determine if something like this might be helpful or not. But in any case, sometimes the whole body needs to be treated, not just sort of focused on the nose, even in the sinuses, even though that may be the complaint area of complaint for somebody. So you might need to incorporate other things like nutrition or physical protection measures like wearing a mask or goggles or something like that. You might also be interested, if there are issues with the nose, you might also be interested in my video on Marma therapy, which is essentially acupressure, but from an Ayurvedic or traditional Indian medicine perspective. And I go through all the points related to the nose. So if that's of interest, you can catch that video for other techniques that help. Cautions or contraindications: if you're thinking about doing a nasal rinse, if you're afraid of it, don't do it. If you're afraid of water, don't do it. If you have a deviated septum or something similar to that, where it's like completely blocked off the nasal passages and water can't go through or can't be cleared well, that's not, particularly a time when you'd want to use a nasal rinse. If there's unsteadiness, so if your handshake, maybe you have Parkinson's or have some kind of intention tremor or something like that, that may not be great, because if your hand is shaking and the water is kind of splashing around, you might actually end up swallowing it, because the water's not flowing in and out well, and then if you swallow it, you can choke on it, and so that would not be advisable. If there's any sort of recent injury, surgery to the nose, face, you want to clear nasal rinsing with your doc before, make sure that's all cleared up beforehand, because you don't want like water, seeping into passages and potentially opening up sutures or something like that, if that's what's going on. So just make sure everything's fairly intact. Yeah. Okay, so let's go through technique, and it may seem very simple, but actually the details are really important here. I tend to find if people are doing nasal rinsing on their own, they tend to use, they almost always tend to use salt water. You don't always need to use salt. But the other thing is that they use way too much salt, like they're putting teaspoons or even a tablespoon of salt in a cup of water, which is going to be way too salty, and it's going to be very irritating and drying for the nasal passages. So that would not be something that's sustainable, like for daily practice. But let's get into the technique here. So you take a cup of clean water, and clean is, relative depending on where you are in the world. But you might want to do something like boil tap water and then cool it down. You don't want to insert boiled water into your nose for obvious reasons. Or you could use filtered water. I've seen on the internet in a lot of places, people are recommending distilled water. I do not recommend distilled water, because the ionic composition is different from your body, and so it may actually draw out, because distilled water is so pure, it will potentially draw out like salts and other minerals from the tissue and dry it out and cause other issues. Basically, you can get like cell death and stuff like that for some of the epithelium there. So distilled water is it's almost sort of, I wouldn't say too clean, but it's too pure. You do want to get something that's isotonic, something closer to tap water. But again, you want to make sure that tap water or well water, if you're using it, is clean. Because without clean water and clean ingredients, clean equipment, you can introduce a new infection, which, we're trying to get rid of potentially the first one, right? So it's generally more comfortable if you use tepid, so body temperature or slightly warm water. If you use cool water, it will sting usually, because what happens is that cool water is going to constrict the blood vessels. So probably, again, room temp or slightly warm is usually most comfortable. So what you're going to do with this, cup of clean water here, there are different methods for introducing the fluid, and this is for the first three I've listed down below. So this is either putting the solution in your hand, again making sure your hand is clean, using a syringe without a needle, so just like a, what do they call it, that it's that thing that you push in I'll remember it as soon as I stop recording. But a syringe without a needle, or you can use a premixed spray, like those are commercially available. But what you do is you're going to close one nostril, like maybe press the outer part of the nostril with your finger, and then you're going to introduce the fluid into the other side. Okay, and you can gently breathe this in so it goes in a little bit deeper, and then you're gently going to blow it out. If you breathe in and out too hard, you can cause more pressure, you can cause, too much change, like maybe there's some blood clots, the blood clots might come out, and if the blood clots are dislodged, then you might get some bleeding. So I would be gentle with the breathing in and out. I wouldn't be too harsh there. And so you do 3 times on each side. Close one nostril, do it 3 times, then switch, close one nostril, do the other side 3 times. And you can repeat this whole procedure once or twice a day. I typically wouldn't do more than that because you probably need something else. And if you do too much rinsing, especially if it's salty, you're gonna clean out the area too much, and that itself, just rinsing too much, can cause irritation to the mucous membranes in there and dry them out. And then just by being dry, you can get infections that way, a secondary infection, or again, it can cause bleeding if the tissue's too dry. So you don't want to overdo this stuff. As I mentioned, there are several ways of delivering the fluid. One is you can put the solution in your hand. That's typically what I do because it's sort of quick. It's quick. So I make up my solution. I pour some in my hand. I close one nostril, and then I breathe in the water gently through the other side, the side that's open. And then I gently breathe it out. I do that 3 times on one side, and then I do it 3 times on the other side. Again, you can also use a syringe without a needle just by, pulling up with that. Again, I still can't think of the name. It's so funny. It'll come to me. Again, probably right after I stop recording. And you can actually hear my voice right now. This is, again, from all the air quality stuff that's going on. I woke up this morning and it almost sounded like I'd been smoking around at a club all night or something. And that's from all the stuff that's been in the air. So irritating my mucous membranes. So I need to do pretty well with hydration today. But anyway, back to the talk. So again, you pull up through the syringe the fluid, and then again you close one nostril, and then you insert, and push up a little bit the fluid, not the whole syringe, but you insert the syringe into the tip of the nose. You don't push that up into the nose, and just push the stopper. Oh, it's really bothering me. I can't remember it. Anyway, it's not coming to me. It's so simple too. And you just gently insert the fluid and let that, you can kind of blow that out a little bit or let that drain out, and then do that 3 times on one side, switch sides. And that's your technique. The premix sprays, I've seen like bottles where you squeeze the bottle, or there's some where like you have this little like misting spray, like the misting nozzle at the end. You can use those. Some of them have more pressure than the others. The ones that I've seen typically don't have a lot. So you might want to actively breathe in and out to help that fluid go in and out so there's a better rinse. I don't find that the premix sprays actually go that deep. They might kind of get to the middle part of the nose, but I don't find that they really get in that deep. So but if that's what's available, that's what's available. And then the fourth option here is a neti pot. So with the neti pot, you don't close your nostrils. And there's some tips and tricks to working with the neti pot. Some people hate it because they feel like they're swallowing water and stuff, and that's usually because of the technique. So with the neti pot, what you want to do is you want to tilt your head so it's like flat, like you're lying your head on a table. Like you want it that parallel with the floor, with the ground. And you want to look off to the horizon. You want your nose and your eyes to be looking off in the direction of the horizon. Okay, so again, you can actually, have your, like maybe if you're doing this over a sink or something like that, literally lay your head on the side of the sink where the nose is sort of over the sink so the water can go up, in and out and drip into the sink or whatever. But you want your head that horizontal with the plane of the ground. Okay, and the horizon. So you lay you lie your head flat horizontally. You do not close a nostril. What you're going to do is the fluid is in your neti pot, and you're going to insert the tip of the neti pot into the top nostril, and you're going to lift the neti pot. You don't move your head at all. If you move your head, that's when you start to, the water's going to go down your throat. You're going to feel like you're choking. So you just leave your head there. Don't move your head. You gently insert, just a little bit, not deep into the nose, into the nasal, just a little bit. You insert the neti pot, and then you're just going to tip the neti pot. Don't tip your head. And then if you do this correctly and there's some movement between the two nostrils, you might be pretty blocked up, and so this won't go all the way through. But if you have some opening between the two nostrils, what's going to happen is you're going to pour the water gently in the top, and it's going to pour gently, it's going to stream out gently from the bottom nostril. So obviously, because it's streaming out the other nostril, this is pretty messy. You want to do it over like a big pan or the sink or something like that to catch the water that's streaming out. But if you do it correctly, it's like just a gentle little stream. and because it goes through both nostrils, it's really good to really flush out the nose and that sort of thing. So those are the 4 ways of delivering the fluid. So far I've only been talking about water. I haven't added anything to the water, so I will talk about that. If you want to add salt, I usually only suggest using 1 or 2 pinches of salt for the cup of water. You don't need a ton of salt. Just a pinch or 2 of salt in a cup of water is already going to make the water pretty salty. And what the salt tends to do is it tends to help break up mucus. It also is a natural antibiotic for some pathogens. So if there's a lot of mucus or an infection involved, you might want to add salt. The best kinds of salt are sea salt because it's non-iodized. There's also no caking agent, so I wouldn't use probably most commercial table salts. But if you check and the salt you have is non-iodized and there's no caking agents, it might be okay. Max salt I would use for a cup of water is 1/8 of a teaspoon, and that's still a lot. So again, on the internet, I see all over the place teaspoons and tablespoons. That's a lot of salt, too much salt as far as I'm concerned. The thing that I don't see much is that for a lot of people who have a dry constitution, generally dry nasal passages, or have dryness from some kind of irritant or infection or something like that, the nose is too dry, in which case I would not use salt because that's going to dry things out more. What I would do to, again, improve the milieu of the nasal passages, add 5 to 10 drops of either organic sunflower or olive oil to the water. And I don't tend to do much nasal rinsing because my nose tends to be dry, so I almost never add salt. That's a very rare thing for me. Just using plain, just water without anything in it is fine. I actually did use the what did I use? I used olive oil when I got COVID. It just blew out my nasal passages. It was so dry. I was getting a little bit of I was getting sneezing because it was so dry, because it was breaking down the protective barrier, and even like a few little blood clots and stuff like that. So I just knew it was super dry. So I added a few drops of olive oil to water, and I just breathed that in. I put that in my hand, breathed it in on both sides 3 times, and that's what got my nose back in shape, because it was just so dry, and everything irritated my that I was breathing in, and I lost my sense of smell as well. And once I did that, for 2 or 3 days, my sense of smell came back. Yeah, and then my breathing was better because it wasn't so dry, and anything I breathed in was just like it, just felt like something was irritating and scraping up against my nose. It was that sensitive. So that's a possibility. When in doubt, if you don't know, should I use salt? Should I use oil? When in doubt, use water only. That's the middle way. You can go wrong. More with salt and doing too much salt, especially if you're doing it multiple times a day for a long period of time. If you're doing too much sunflower, olive oil, or something like that, it might make it, for some people, again, depending on their own constitution, it can kind of make the nasal passages a little bit goopy. And because it's goopy, and sticky, it can actually cause more infections over time. So again, you have to have the right balance. And I think, as I mentioned, too much rinsing. So even with too much water, like if you rinse your nose 3-4 times a day, and you're constantly flushing out whatever's there, you might be disturbing the natural balance, and that will cause dryness and possibly bleeding. If you use salt water too much or too much salt, it can also cause dryness and bleeding. And of course, with all of this, you want to make sure that ingredients and equipment are all sterile and clean, because if they're not, you can cause another infection that way. Yeah, so the nitty-gritty details, but again, I see plenty of people doing nasal rinsing and they're not achieving the results they want because of a lot of the details that I've just gone through. All right. So, as always, thank you for your time. Thank you for listening. Thank you for being interested in health and wellness. Hopefully, if you do have an infection or allergies, or maybe you're living in or working in an environment where the air is not great quality, then the nasal rinse can be helpful. Also, I have another YouTube channel on Vedic Astrology called Light Vedic Astrology, if that's of interest to you. But otherwise, I hope you enjoy hydrotherapy as much as I do. I actually really enjoyed my time when I was a professor of that field. There's a lot of interesting history to it, and it's kind of a lost art. So I'm glad I got the chance today to dig back into the files. All right, so as always, take care, and until next time, all the best.